Hi, everybody. We are going to wait a few minutes to get started. I'll let some more people join. I know I'm a couple minutes early. Hi, Brenda. Hi, everybody. We are just going to wait another couple minutes to get started. I know I signed in a little bit early, and then I'll kind of guide you through what you need to know and what we're going to do. Thanks for joining, everybody. Just another couple minutes. I hope you're all having a good day. It's not raining here finally, which is a great day for me. I know it's 11, but I'm gonna wait until probably like 11:02 to begin. So we have a couple more minutes for people to join. Thank you to everybody who is here. You're all super prompt, which is awesome. Julia, you are muted. Everybody is muted. I have the ability to unmute you, but if anybody has questions, you can either enter them into the chat or you can submit a Q&A. And Deeksha, I see that you raised your hand. Hey, Brenda, I see that you raised your hand too. I'm unmuting you, Brenda. What's up? Or are you just saying hi?
Can you hear me now?
So wait just another minute. Again, thank you to everybody who's here, and then we'll get started really soon. And again, if anybody has any questions, you can either submit them into the chat or the Q&A. And I'll also kind of have time for available questions throughout the presentation. Give it one more minute or so. Hope everybody is doing well. Super excited. Let's get started. And then for anybody joining late, they can either play it back if they need to or ask questions if they need you to. So my name is Rebecca Medansky. I am a pelvic floor physical therapist and the owner of Ladybird Physical Therapy, which is a PT clinic that focuses entirely on pregnancy and postpartum. So pretty much all I do is I help people manage pregnancy pains, prepare for birth, and then recover postpartum. It's important to mention that postpartum does not mean just 2 days. It does not mean just 2 weeks. It does not mean just 2 years, right? I see people who are anywhere from a day to 20 years postpartum, and they can all get better. So it is never too late. And I got that question from a couple of you when you submitted your registration. It's never too late to get better. So please keep that in mind as we're talking today. Another thing that I want to make sure that we mention ahead of time is a disclaimer. So this video is going to be recorded. None of you have your video playing. It's just mine. So the only thing that I want to make sure you know is please do not submit any personally identifying information into the chat or into the Q&A. And if you have any questions, know that they can potentially be recorded, okay? And I'm just going to open up my window. All right. So, on our agenda today, we're going to be discussing what the pelvic floor is and what its function is, what some common pelvic floor conditions are and why they occur, how the pelvic floor muscles are impacted by pregnancy, by birth, and by the postpartum recovery, and what can you do about it, and how do you reconnect with your pelvic floor, and where should we go from here? So those are going to be the main questions that we're going to be answering, and then we're going to be kind of stopping throughout the process for Q&As. I'm going to be sharing a PowerPoint with you and kind of bouncing back to my screen. So we'll be going back and forth. If you have any questions throughout the process, please let me know. I'm going to share my screen. Okay, let me just, this is the first time I've done a presentation. So this is also kind of new for me. So bear with me. So again, this is our agenda, right? These are the 4 main things that we're going to be talking about. The main takeaway that I want you to have from today is if something feels wrong, you do not have to accept it as your new normal. If your provider tells you that's just part of being postpartum, you deserve another opinion. There are answers to your questions. So please, if you're having any symptoms, any pain, any complaints, if anything that I'm saying today is like, oh yeah, that sounds like me, and know that there are answers to your questions and that this is not just a normal part of being postpartum. Now, we're going to start today with what is the pelvic floor and what is its function. And I'm going to switch back to me so that I can show you a couple things. I see a question in the question box. Are you able to get the PowerPoint after today? You can have a recording of the presentation, so you're going to be able to see the slides through there. So what is the pelvic floor? Let's talk about it. So this is a pelvis. This pelvis, here are our hip bones. Here's our lumbar spine. This is our pubic symphysis, our tailbone back here, our sacrum in the back. So this is a pelvis, okay? If we are sitting upright, this is the orientation of the pelvis. I'm trying to move so that it's not in my face. We're sitting upright. This is the orientation of our pelvis. We're laying down on our back. This is what we see, right? So this is somebody laying on their back with their legs towards you. Tailbone down here, pubic symphysis up here. Our pelvic floor muscles are all of the stuff that we see in red. Now, what is the pelvic floor? That's the question that we're answering right now. The pelvic floor is not just muscles, right? The pelvic floor includes nerves, includes blood vessels, includes fascia, includes all of the stuff that happens through here. But what we're going to be focusing on primarily is what are the pelvic floor muscles. So when we look at this tissue, we see the superficial muscles. That's what we can see externally, and you can actually feel these on yourself. So if you palpate your perineum, which is that band of tissue between the vagina and the anal opening, you can feel this muscle through here. If you palpate through the labia, you can feel this muscle. And then if you palpate along the pubic bone, you can feel this muscle. So these are all superficial. If we do an internal exam, if we look at a vaginal or rectal exam, we can see the deeper pelvic floor muscles. So these you can't feel externally. That's why a pelvic floor PT will do an internal exam, because you can't get to these any other way. If we look closer, what you can see in the pelvic floor is the urethra, so the opening to the urethra, the vaginal opening, and the anal opening. So there are 3 openings in the pelvic floor. That's why these muscles affect our bladder, sex, and then bowels, right? Because that's what goes through the pelvic floor muscles. A lot of the conditions that we're going to be talking about today, and a lot of what we're going to be talking today, is pelvic floor muscle tightness and pelvic floor muscle weakness. I'll get into that a little bit later, but these are the pelvic floor muscles, the superficial layers, the deep layers, and you can see they kind of sit like a hammock at the bottom of the pelvis, at the bottom of our body. Any questions about the pelvic floor? No? Okay. So I'm going to go back to the PowerPoint now. Okay. What is the pelvic floor and what's its function? So we answered what the pelvic floor is, right? There are pelvic floor muscles, superficial muscles, deep muscles. There are 3 openings, the urethra, the vagina, and the rectum. And then there are nerves, blood vessels, and fascia. That's what encapsulates the whole pelvic floor, but the pelvic floor muscles are all of those things in red that I showed you. I really just wanted this slide so I could share this amazing picture of my cat who crawled behind the pelvis and then went to sleep yesterday or a couple days ago. I actually think while I was on the call with you, Brenda. So that's for your enjoyment. What is the pelvic floor's function? So this is a really important thing to discuss. What does the pelvic floor do? It has a lot of really important jobs, right? One is it supports your organs. So from underneath, it acts as a physical, mechanical support at the bottom of our pelvis to hold everything up. It supports our core and our breath. So this is a really important point. Our pelvic floor does not work alone, right? It doesn't live in a vacuum. These muscles, your pelvic floor muscles, work really intimately with the muscles in your abdomen and the muscle of your diaphragm. So the pelvic floor, whether it's really tight, whether it's really weak, will influence the abdominal muscles and even our breath. And again, I'm not going to be getting really deep into that today, but it's a really big part of the pelvic floor function. It assists in hip strength. So there are actually muscles in the pelvic floor that contribute to rotation of the hip, so control and strength of the hip. It assists in bladder and bowel control, which we've talked about a little bit. So these muscles have to be strong enough to stop you from losing urine, gas, or stool when you don't want to. And they need to be flexible enough to allow you to fully empty your bladder, your bowels, when you do want to. And then the last main function of the pelvic floor is sexual function. So the vaginal opening goes right through the pelvic floor muscles. The pelvic floor muscles surround the vaginal opening. In people with a penis, the pelvic floor muscles play a big role in maintaining erections as well. So male or female, the pelvic floor muscles play a big role in sexual function. So we're going to be talking a little bit about bladder and bowel dysfunction today, sexual dysfunction, and other types of pain and how these muscles influence that pain. Before we go on, any questions on the pelvic floor, on the pelvic floor's function? I'm going to just give you a second. No questions? Cool. Okay, so let's go onwards. What are some common pelvic floor conditions and why do they occur? So, at the root of pelvic floor issues comes this tension and this weakness, kind of push and pull. So if we think about any muscle, let's pick a muscle we're more familiar with, a hamstring. If your hamstring is really tight, which we've all kind of felt before, right? You sit for a really long time at work all day, you're on a long flight, you're in a long car ride, and your hamstring just tightens up. You stand up and you're like, wow, I can't even straighten my legs out all the way. Tightness in the hamstring can lead to knee pain. It can lead to hip pain. It can lead to IT band pain. It can make you walk funny. It can do all sorts of stuff. Weakness in the hamstring can actually do the same thing. It can make all of those things hurt. It can make you more prone to injury. It can also kind of make you walk funny. It can just feel not quite right. It can even contribute to falls, right? Tension and weakness in any muscle is not good. When we're looking at the pelvic floor muscles, it's the same thing. These muscles can be tight and these muscles can be weak. And if they're too much of either one of those things, and if they're not in the right balance of strength and flexibility, then that can lead to pelvic floor symptoms, right? Pelvic floor conditions. So on this next slide, and I'm going to warn you before we go there because it's a dense slide, I've broken pelvic floor conditions up into tension and into weakness. So pelvic floor conditions based on if your muscles are tight, based on if your muscles are weak. You do not have to memorize a slide. Let's take a big deep breath, and now we're going to look at it. Okay, so tension, weakness. So these are not, it's important to note that this is not entirely accurate, right? I'm trying to give you a really bird's eye view of what might cause some of these things. So I don't want you to look at this and say, oh, I have SI joint pain, I must have weakness. That's not entirely true. But let's start with the tension category. So some common symptoms associated with pelvic floor muscle tension are difficulty emptying your bladder, strong, sudden urge to pee, urinary frequency, so this need to pee all of the time, pain with sex, pain following orgasms, tailbone pain, vaginal pain, rectal pain, scar pain. Now, again, a lot of pain conditions, a lot of constipation should be on that list too. I don't think I listed it, but it should be on that list too. So there are a lot of things that can happen if the muscles in your pelvic floor are too tight. Now, we look over at weakness, leakage again. So there is leakage in the tension category, leakage with this strong sudden urge, whereas leakage in the weakness category is more leakage with coughing or sneezing, leakage with positional changes, decreased sensation with sexual activity. So we might not have pain with sex, but we might just not feel as much. Difficulty achieving orgasm. So rather than pain following orgasm, difficulty even having one, but also pain, right? SI joint pain, low back pain. Diastasis recti is on that list, fecal leakage. Again, I do not need you to memorize this list. My point is just that when somebody calls me and says, hey, I have leakage, what do I do? My question is always, what is causing this person's symptom, right? So, and most often people straddle this border, right? They really fall into both, and that's where things get really tricky. So let's kind of take it back a notch. Why does this matter to you, right? Why do you care that there's tension and weakness and this causes all of these issues? The reason why it matters is because a lot of these are extremely, extremely common. All of these statistics are for postpartum people. They're taken from different studies, which I'm happy to share with you at the end of all of this if you'd like them. But let's go through this. So 45% of postpartum people report stress incontinence, 45%. 60% of postpartum people report pain with sex. I believe that's up to 1 year. I think that's what that statistic was for. 77% report low back pain that's so significant it interferes with their day-to-day tasks. Diastasis recti, I threw this one in there. We're not focusing a lot on diastasis today, but I wanted to make sure that that we at least threw it in there a little bit. So 100% of people will have a diastasis during pregnancy. 33% will still have that at 6 months postpartum. 50% will have prolapse upon vaginal examination, of which 15% will have surgery for prolapse throughout their lifetime. So if you're looking at this and you're like, whoa, that's a lot, that's not my goal. My goal is not to overwhelm you. Rather, I want to make sure that you know if you're having any of these symptoms or any of these conditions, you are not alone. This stuff is incredibly common. I see somebody asking me a question. Yeah, I know, it's crazy, right? It's really, really shocking how common this stuff is. And I got another question of what is diastasis recti? Oh, I lost they're gonna go back. What is diastasis recti? Diastasis recti is when you have a separation in your abdominal muscles. Another question that just popped up. So diastasis recti is a separation in the abdominal muscles, which is again, 100% of people have this during pregnancy because as the belly grows, as the baby grows, the abdominal muscles separate because the baby has to go somewhere. And it's easier to push forward into the belly than it is to push backward into the spine. So that's what a diastasis is. What is prolapse is another question that I just got. Prolapse is, so I'm just trying to click out of it. Prolapse is when you have organs in the abdominal cavity that descend downwards into the vaginal canal. So it's very, very common postpartum because when you're pushing throughout birth, when you're carrying extra weight throughout pregnancy, the pelvic floor and the organs in the abdominal cavity are under additional stress. And so afterwards, these organs can fall downwards. And when we have weakness from the pelvic floor from underneath, they lose that support. And that's when people start to experience heaviness, or sometimes they'll say it feels like I'm sitting on a ball. That's what prolapse is. It looks like I have one more thing in the chat. Can you explain prolapse upon vaginal examination? Yes. So prolapse, again, is when you have that tissue that falls down further from where it was before. Prolapse upon vaginal examination means that they are determining that 50% of the people in this study had a prolapse. They did that by doing a vaginal exam. So they did an internal pelvic floor exam, an internal vaginal exam. I assume, I don't remember exactly, but probably with the use of the speculum, and they either saw or felt that there was a prolapse there upon that exam. Can you have a prolapse without that heavy feeling? Yes, that's another question that I just got in the chat. Oops, again. You can have prolapse without a heaviness feeling. So if you look at the amount of people who have prolapse versus the amount of people who have the sensation of heaviness, they don't line up. A lot of people don't even know that they have it. And what's interesting is that when you look at prolapse, and I wasn't really planning on getting super in depth here, but when you look at prolapse, when you look at, like I said, it's this descending tissue. So depending on how far it descends, it's graded on a 1 to 4 scale. What's interesting is that 1 means that there's a small descent, whereas a 4 means there's a big descent. When you look at the symptoms of heaviness, like what people feel if they have prolapse, it actually doesn't really closely relate to how severe the actual prolapse is. So there are a lot of factors involved with what people feel with prolapse. But yes, you can have heaviness and not have prolapse. You can have prolapse and not have heaviness. And you can have any grade of the prolapse with any amount of symptoms. There's one more thing in the Q&A that I'm going to look at of the people you see. Do you tend to see more tension or weakness as the predominant factor? That's a good question. And honestly, I think most often it's both. I think it's pretty rare that somebody is truly just tension or just weakness. It's really, really common that it's both. Let's move on, and then I'll get to any other questions. We'll have another break for questions as we go. So now we're moving into how are the pelvic floor muscles impacted by pregnancy and what you can do about it. So we're going to go pregnancy, birth, postpartum. Pregnancy and the pelvic floor. So this is one thing I want to make sure everybody leaves here knowing. The pelvic floor muscles are impacted by pregnancy regardless of your method of birth. Whether you have a vaginal birth, whether you have a cesarean birth, whether you use an epidural, whether you don't use any medication, whether you have a home birth, a hospital birth, your pelvic floor muscles are impacted no matter what. The reason for that is that your pelvic floor muscles work harder throughout pregnancy to support the increased weight in your abdominal cavity, right? You have a growing baby in there. You have increased fluid. So the pelvic floor is working harder to support us from underneath because that's one of its jobs, right? Support. We have increased mobility in the pelvis because as we have more relaxant in our system, as the pelvis becomes more mobile, our pelvic floor wants to work really hard to keep us stable because we still have to walk around. We want that stable base of support to walk around comfortably. And then the third reason is that a growing baby pushes on the bladder. If you constantly feel like you have to pee, your pelvic floor muscles are constantly going to be tightening up to stop you from peeing, right? They're going to constantly be contracting. So what happens when these muscles work really hard for a really long time is then they get fatigued, right? And when they get fatigued, that can lead to leakage of urine, of gas, of stool. It can contribute to sensations of heaviness in the pelvis. It can lead to pain in the SI joint or in the pubic symphysis or back pain. So the pelvic floor muscles are working really, really hard throughout pregnancy, and that can tire them out. Now, what can you do about it? So pelvic floor muscle training during pregnancy, this is a really a hot topic, I would say, right? Like what can you do during pregnancy to set yourself up best? So let's look at these 2 research studies. One is the effect of pelvic floor muscle training during pregnancy and after childbirth on prevention of leakage, right? So let's simplify that. Basically, this is doing pelvic floor strengthening during pregnancy to see what happens with leakage afterwards. That's what the study was about. What they found is that a supervised training protocol, so supervised strengthening for 8 weeks during pregnancy, reduced leakage during pregnancy and postpartum. They also found that training, so pelvic floor muscle strengthening after birth, can reduce leakage after birth. So this article said that if you strengthen your pelvic floor in a supervised way for 8 weeks during pregnancy, you're less likely to leak during pregnancy, you're less likely to leak afterwards. Now, the second study, so that's that weakness, right? The strengthening that we're focusing on there. Now, the second study, Too Tight to Give Birth, I don't like that name, but it's an interesting article, Too Tight to Give Birth. So they assessed pelvic floor muscle pressure, that's what they called it, so muscle resting pressure, so how tight basically the muscles are, and how that impacted birth. So what they found was that strong muscles, strength, was not a bad thing during vaginal birth, right? Strength was not disadvantageous for birth. However, people whose second stage of labor stalled, so people who had a longer second stage of labor, had significantly higher resting pressure. What does that mean? It means that people with more tightness in their pelvic floor muscles were more likely to have a longer second stage of labor. The reason why that matters is because longer second stage of labor, so having a longer time in that push phase, can increase the likelihood of progression to a C-section. I see a couple questions in the chat. Constipation during pregnancy is because of pelvic floor muscle involvement or anything else. Constipation during pregnancy, the pelvic floor can definitely be a factor, but it is certainly not the only factor there. There are a lot of things that could contribute to constipation during pregnancy. And what advice do you give to folks who are having leakage during pregnancy? I've heard that Kegels in pregnancy can increase the risk of birth dysfunction. So that's kind of what we're talking about here, right? For people who have leakage during pregnancy, pelvic floor muscle strengthening can be effective in reducing the leakage. Now, strength in the pelvic floor muscles is not a problem for a vaginal birth or for any birth. There's nothing wrong with being strong. Where the problem comes in is if we have tightness in the muscles. So when I give somebody a strengthening program or Kegels during pregnancy, I always make sure that we are also adding in stretches, right? So that we're not just tightening and tightening and tightening, but then also learning how to relax at the end of it. The same way that if you went to the gym and you did hamstring curls and bridges and deadlifts and all of these exercises to strengthen your hamstrings, if you didn't stretch at the end of that gym session, and then if you did that every day for 6 months and you never stretched, you would be in pain, right? You'd have problems. So if you're doing a strengthening program, you want to be doing a stretching program. So the takeaway from all of this, and I stuck on this and sort of already gave you the takeaway, but the takeaway is that strengthening can reduce leakage. Strengthening during pregnancy can reduce leakage. Pelvic floor strengthening during pregnancy needs to be paired with pelvic floor muscle relaxation so that we're not, again, putting you at risk for stalling that second stage of labor. Strengthening is good. Tightening is not the same thing as strengthening. And pelvic floor physical therapy can help you figure out that right balance for your program. Next, we're going to move on to how are pelvic floor muscles impacted by birth, but I think we have one more question before we do that. So one question, there are many women who don't exercise during pregnancy, especially Kegel exercises. Why is it that some women get urge or stress incontinence and some women do not? Why is it that some people have any pain and others do not, right? Everybody's body is different. It could depend on how active that person was prior to pregnancy. It could depend on how much strength training they've done on their lives. It could depend on their general level of activity, on their anatomy, right? Everybody is different. And that's why when people say like, well, what can I do during pregnancy to help myself prevent this? I always say like, we need to talk a little bit more before I can give you that answer because it's different for everybody. And then one more question. I pushed for almost 3 hours during a VBAC. It was because I could not relax. How do I relax? We're going to talk about one way to help your pelvic floor relax at the end of all of this. So I will get into that. And then I think I saw one more in the chat. I had a friend recommend a belly band to support my pregnant belly during the last trimester. Could this help me relax my pelvic floor by reducing the pressure on the baby, or should I continue strengthening for the pelvic floor? Let me make sure I reread that one more time. A belly band to support your pregnant belly. Could this help relax your pelvic floor muscles? So a belly band is great if you feel like you need the support, right? So I always say, like, if you have to go to the grocery store and you're pushing a stroller and you're going to be carrying a lot of weight and you're uncomfortable, a belly band can help you feel more supported. I would wear it in that moment. I wouldn't wear a belly band 100% of the time, and I would still work on pelvic floor strengthening and pelvic floor muscle relaxation. Let's move on to how are the pelvic floor muscles impacted by birth and what you can do about it. So we went through pregnancy, now we're at birth. The pelvic floor and birth. I got this image from my pelvic floor muscles from their Instagram, and it's very silly, but I really like it. So the pelvic floor muscles, we're going to break this up into a vaginal birth and a cesarean birth. So starting with the vaginal birth, during a vaginal birth, your pelvic floor muscles have to relax to allow the baby to pass. That's why if you can't relax them, if there's a lot of tightness, you can stall that second stage of labor, right? Because if the muscles can't stretch, as the baby descends through the uterus, descends past the cervix, it hits this clenching from underneath. So the muscles during a vaginal birth may stretch 3 to 4 times their general muscle length. 3 to 4 times. That's why injury to pelvic floor muscles is so common during birth, because they're stretching so much. And one of the ways that this injury occurs is perineal tearing. So tearing at the perineum, because the muscles are stretching. If they're resisting, or if they stretch too far, they can tear. Now, I know that sounds really scary to a lot of pregnant people, but think about how common it is. So the American College of Gynecology estimates that 53 to 79% of people experience some tearing during birth. 53 to 79%. That means that you are far more likely to tear than not to tear, right? There are things that you can do to reduce the risk of tearing, absolutely. But I always tell people that that is not the worst case outcome. A lot of people will will recover from tearing without any issues. And there are lots of things that you can do to help yourself recover. So that's the pelvic floor and a vaginal birth. Now, pelvic floor and cesarean birth, I talk to people all the time who are like, I had a C-section, I'm fine. And I always say there is no get out of jail free card for your pelvic floor. Like we talked about earlier, the pelvic floor is affected by pregnancy. It is also affected by a cesarean birth, because a C-section is abdominal surgery, right? It's an abdominal surgery that cuts through 7 layers in the abdomen, weakening the abdominal muscles, because the muscles are weakened when they're injured, and that's what surgery is. The abdominal muscles work really closely with the pelvic floor. So if you weaken the abdominal muscles, you by association can weaken the pelvic floor. Now, additionally, a C-section can lead to a scar. It does lead to a scar, right? So a C-section will lead to a scar in the abdomen. Scar tissue can contribute to tightness in the abdominal muscles if we don't treat it correctly. And that tightness in the abdominal muscles can lead to tightness in the pelvic floor muscles. So a perineal tear can lead to scarring in the pelvic floor, which can do the same thing, right? Can lead to tightness and weakness in the pelvic floor muscles. A C-section will lead to a scar in the abdominal muscles, which can do the same thing. So again, people's pelvic floor will be impacted, whether it's a C-section or whether it's a vaginal birth. The takeaway, I've said it a dozen times already, but regardless of your method of birth, your pelvic floor is affected. Pelvic floor PT can help you prepare for birth by helping you strengthen your pelvic floor muscles, helping you learn to relax these muscles, helping you learn to reduce your risk of perineal tearing, discussing pushing techniques to help reduce the stress on your pelvic floor muscles during birth and labor, discussing birth positioning to reduce injury and improve outcomes, and pain management. I'm going to pause again. Any questions on the pelvic floor and birth before we move on to the pelvic floor and postpartum recovery? One question: I have never been pregnant or given birth in the past. I've had a perineal tear in the past from another cause. Can that impact my ability to relax my pelvic floor muscles? Absolutely. I today am focusing on the pelvic floor and how it's impacted by pregnancy and birth and recovery and postpartum recovery, but your pelvic floor can be affected by a million other things. Pelvic floor physical therapy is not just for pregnant and birthing people. Absolutely. If you have a scar in your pelvic floor, if you've had any injury to your pelvic floor, that can impact your ability to relax the pelvic floor muscles 100%. Another question: how can we accommodate positioning if getting an epidural? By accommodate positioning, I don't know if you mean how can you try different positions if you have an epidural, because many hospitals won't let you move as much after an epidural, right, for safety reasons. So what you can do if you have an epidural is you can still ask for a bar to go over the hospital bed. You can pull yourself up on that bar to get into a more supported upright position. You you really want to work with the hospital staff on this. You want to tell them what you want to do. You can ask for that bar. You can ask them to support you in side lying. You can have a partner support your leg with you laying on your side. You can ask if somebody can get into the bed and support you from behind. There are a lot of things that you can still do even if you have an epidural, but in part that's going to be dependent on your staff. And it's a great conversation to have with your OB prior to birth as well. What can I do once I have this epidural? Another question, what about the release of an air sound / fart when doing downward dog? Do levels help decrease that sound? I think levels are Kegels. I'm assuming that's a typo. But yeah, so a releasing air, whether it's vaginally or whether it's from the rectum, right? So whether it's passing gas, either way, can often happen if we have weakness or more laxity in the pelvic floor muscles, because air can get up and then when we move, it can release. Passing gas rectally can also be, it's a form of leakage, right? So leakage means incontinence means urine, gas, or stool. So doing pelvic floor strengthening, if you need strengthening, doing Kegels can help reduce leakage of gas for sure. Another question, how do you come to know the pelvic floor muscles have spasm or tightness? Is it palpation or any clinical test? The only true way to know is having a pelvic exam by a professional, right? By a pelvic floor physical therapist or a gynecologist who's trained in assessing pelvic floor function. But there, again, if you look back at that list of weakness and tightness, there are some signs that you can start teasing out on your own to figure out which category you fall into. And when I do virtual visits with people, we spend a lot of time talking about how you figure out on your own which category you fall into. And then one more question before we move on. Can your muscles relax if they're tight during the second stage of birth? Or do you have to go into birth with already relaxed muscles? I think that it's really important for you to practice pelvic floor muscle relaxation prior to birth, because the likelihood that you're going to be able to do that easily with your body during that time of intensity it's going to be a lot harder. So I think that was all the questions for now. We're going to move on to the pelvic floor and postpartum recovery. So how are the pelvic floor muscles impacted postpartum, and what can you do about it? And I want to see, how are we doing on time? We're at 11:30. We're okay. Okay. So the pelvic floor muscles and postpartum recovery. The early weeks are a great time to begin reconnecting with your pelvic floor. My next slide is going to be a timeline for what you want to do when and what you can kind of expect when, but the early weeks are a really good time for you to start reconnecting with your pelvic floor. Can you feel them turn on? Can you do a Kegel? Can you feel them relax? Because regaining strength and flexibility are equally important. Hopefully I've harped on that enough. It's like, I feel like a broken record, but strength and flexibility, weakness and tension, these things are both really important to address. It's important to look at your pelvic floor. Now, I don't recommend that people do that day one, right? But I see a lot of people who are a year postpartum who still say that they're terrified to look down there, and we'll do that together in a session, right? I'll use a mirror and I'll walk them through how to look at their vulva and what they should be looking for. Because if you're spending your whole life not looking at a certain part of your body, how are you going to know if something goes wrong, right? It's really important to look. Another point is that pain should not be expected past 1 to 2 weeks postpartum. It is normal to have some soreness and discomfort in your first couple weeks, right? You just delivered a baby, that's a pretty big deal. But this should not continue. So when people call me at 2-3 weeks postpartum and they're still hurting, I always say, like, the sooner we can get you started on a program, the better. You should not accept this as part of being postpartum as a reasonable answer to your pain or your symptoms when you complain, or not when you complain, but when you raise your concerns to your provider. General timelines and guidelines postpartum. So when I say early weeks, I mean 1 to 3, right? Your first 1 to 3 weeks postpartum, you really want to focus on rest. You want to be in the bed for the first week, on the bed for the second week, near the bed for the third week. I understand that that's not realistic for everybody. It's just a goal, right? You can, in these early weeks, begin bed-based strengthening. And I'm going to pause for a second. Please read the bottom of this screen. This is all assuming an uncomplicated birth and recovery. You're feeling no symptoms with movement and you've been medically cleared, right? This is for folks who are doing really well. 1 to 3 weeks, you can begin gentle bed-based strengthening. So again, can you feel your pelvic floor muscles contract? Can you feel them relax? Can you feel your abdominal muscles contract? Can you feel them relax? We're not going to get super deep into what these exercises are throughout these timelines. Again, that's a better conversation to have one-on-one. You're welcome. I'm going to give everybody who's on this webinar a free 15-minute phone consult. So you are more than welcome to set up a call with me, ask any questions you have. But gentle bed-based strengthening and postural exercises. So that's weeks 1 through 3. Weeks 4 through 6. So you can slowly start increasing walking distance, assuming you're feeling well. This does not mean go on a mile walk around the house or around the neighborhood. It just means you can start walking around more throughout the house. You can start walking to the mailbox, maybe around the block. Slowly start increasing physical activity. And you can begin gentle body weight strengthening, right? So clamshells, leg raises, arm raises, right? Just so that you're getting your body moving, maintaining the strength that you have. Typically at 6 weeks is when you'll be cleared by your midwife and your OB for exercise and sex. This does not mean that at 6 weeks in a day, you want to run a 5-mile race and have sex for hours, right? This just means that at 6 weeks, that's when you're typically given clearance to start exercising, to start sexual activity. And there are appropriate ways to get back into exercise with low impact body weight strengthening, modifications to prior exercise. This is a huge thing that I talk about with people, how to get back to exercise, but how to do it while supporting your recovery. Scar massage, that's something that you want to start at 6 weeks, whether you had a perineal tear, whether you had a C-section. Working on that scar to help reduce any tension is really important so that we can help our bodies heal. And then if you do have pain with sex, if you do have fear around returning to sex, there are a lot of things that I talk people through that you can do to reduce fear and anxiety, reduce pain if you're experiencing it with postpartum sex. Because if you remember that slide from early on, 60% of people report pain with sex postpartum. It's huge. And then 12 weeks on, so assuming there was a study that came out about a year ago at this point, I think, that basically said if you start with 6 weeks of low impact strengthening from 6 to 12 weeks, by 12 weeks you might be safe to start beginning impact exercise. Again, this is all assuming that you don't have symptoms, you don't have heaviness, you don't have leakage, you don't have pain. If you do, then we need to talk and kind of modify these timelines for you. Let me ask the questions that have been asked in the chat first before I get to my slide of the question on everybody's mind. What about the pain of cesarean, still 1 to 2 weeks? Pain at the C-section scar itself, that can last, it's more tenderness, that can last a little bit longer. That's a little different because you know exactly why it's happening, right? I still don't think that you should be having pain in the abdomen after a C-section past 3 to 4 weeks, and it should be getting better, and you should really be able to tell that it's right at the incision site. It feels like my labia is much smaller now than before. Is that normal because of swelling? So my question would be, do you mean the labia majora or the labia minora? When we're talking about the labia, there are the outer and then the inner lips, right? This model, I know I'm tiny in your screen, but this model really only has the labia minora, the inner lips. The labia minora can be smaller postpartum because that tissue is really hormonally dependent. And when you're breastfeeding or chest feeding, and when you're postpartum, you have decreased estrogen in your tissue, which can cause the labia minora to get smaller. So that could be part of what's happening. And then one more question. My tear is inside my vagina. Should I massage that scar? Yes. If you have tearing internally, you absolutely want to massage the scar internally. You can do that by using a finger. You can ask a partner for help. You can use a dilator or any other toy that you have at home. It should never be painful. You want to be gentle. You want to make sure you're using adequate lubrication. Wait until that 6-week mark when you're cleared for sex. But yes, if you have tearing internally, you still do want to massage that. And then one more question. How often and for how long should one do scar tissue massage on the C-section scar? So again, 6 weeks, right? That's the timeline that I typically will have people start this. I'll have them do it for 3 to 5 minutes, 3 to 5 times a week, right? If you can do it daily, great, but I know that is kind of a big ask. So a few minutes, a few times a week. You want to make sure you're using lotion, and again, same as the internal scar massage, very little pain, no more than 2 to 3 out of 10 pain, gently just working on relaxing that tissue. One more. What if you've already had 2 births and never massaged the scar tissue? Is it too late? No, it is never, ever too late. It's never too late for any of this. It's never too late to get better, it's never too late to work on a scar. It's never too late to work on leakage. It's never too late to work on pain. It's never, never too late to do any of this stuff. And do you have any suggestions on how to get over woozy feelings when touching a scar? Just the thought of it makes me sick. Yeah, that's a really important question. Thank you for asking that. You're absolutely not alone. I hear that from a lot of people, particularly the people who had unplanned C-sections, right? Because we have a lot of emotions stored in that part of our bodies, and it can feel really uncomfortable on a lot of levels. So I always tell people, start at the highest, most comfortable place. If even thinking about your scar makes you sick, then think about a C-section scar on somebody else's body, right? Find whatever it is that doesn't make you feel sick. It could be thinking about the idea of a C-section. The global idea of a C-section doesn't make you feel sick. Then it could be the global idea of you having a C-section. You can just think about that for a few days, a week, until that doesn't make you feel as uncomfortable, right? Until your body calms down. Then you can start thinking like, okay, well, what about the scar? So you're basically going level by level as you're getting closer and closer to your body, right? And as you're going through these different thought exercises, you're working on deep breathing, you're working on keeping your body relaxed, you're working on not tensing and guarding, right? And if you feel like you can't control it, then you want to go back a level. Eventually, if you spend a week thinking about the idea of a C-section, the idea of a C-section scar, thinking about your C-section scar, once you get to the point where thinking about it doesn't make you feel that discomfort, that's when you can start just by looking at it. Right? Look at it in a mirror for a couple minutes a day and just do deep breathing. Try to keep your body calm. Once looking at it feels okay, think about just touching your belly in other areas. So you're slowly working towards that. Again, I'm happy to talk to you about that more specifically because there are a lot of steps that you can do to help get to the point where that doesn't feel uncomfortable for you. Okay, so the question on everyone's mind, we're going to go back to the PowerPoint. What can I do? Right? That's what the majority of you asked me when I asked you to ask a question when you registered for this webinar. What can I do? And my answer, hopefully you've heard me say it enough throughout this PowerPoint, but there are no 5 best exercises for X. There are no 5 best exercises for leakage, 5 best exercises for prolapse. And there are also no 5 exercises that are awful for leakage, 5 exercises that are awful for prolapse. If you ever see those lists, please take them with a grain of salt. We create these lists so that we can make this information accessible, but at the same time, they're not infallible. Everybody is different. Everybody needs something different. One major determining factor for what your body needs is tightness versus weakness. But one thing everybody can benefit from is these 3 things. So that's what I do want to take you guys through. These 3 exercises that everyone can benefit from. Diaphragmatic breathing or breathing exercises, learning how to do a Kegel or a pelvic floor muscle contraction, and learning how to relax your pelvic floor muscles. So we're going to do this together right now. You can do it in any position. It's fine if you're sitting. It's fine if you're laying down. It's fine if you're nursing. Please don't worry about it. Whatever position you're in, we're going to walk through these pretty slowly. So how can you reconnect with your pelvic floor? Where should we go from here? So here are the 3 that we're going to go through. Let's start with diaphragmatic breathing. So wherever you are, I want you to put a hand on your chest. I'm going to tilt this down a little bit so that you can see me even if I'm little. Actually, you know what? I'll just stop my screen share. Okay. So wherever you are, I want you to put a hand on your chest and a hand on your belly. Okay. I want you to first just take a big deep breath in. Where did you feel that air go? I don't know if you were looking at me, but when I did it, I went like this. Right? I took a chest breath. Now what I want you to do, and I'll scoot back a little further so that you can see me. I'm glad that I put on real pants because I thought about just wearing exercise shorts. Now you're going to take a slow breath in, and I want you to think about breathing into your belly hand. Okay, so I want you to think about breathing in nice and slow, letting your ribs expand at a 360-degree angle as you inhale, and then let them fall back to resting. Now put both of your hands on your belly. Same thing. We're going to take a big deep breath in. I want you to fill your belly, fill your hands with air. Now, This is hard for people to learn. I know that that sounds silly, but I think that the thing that frustrates people the most when they're in clinic with me is when we're trying to go over diaphragmatic breathing and they cannot figure it out. So be kind to yourself. Practice this sitting, practice this laying down, practice this in any position. This exercise is great for people who have a C-section scar. It's great for people who have a perineal scar. It's great for people who feel great, right? I do this exercise every time I meditate. Diaphragmatic breathing is good for us. It reduces our level of cortisol. It feels better. So it's a great place to start for everybody who is 39 weeks pregnant, 1 week postpartum, 30 years postpartum, right? Everybody, or never been pregnant. Let's look at how to do a Kegel, right? So what is a Kegel? A Kegel is a pelvic floor muscle contraction. So it's these muscles contracting. So a bicep contraction is this, right? A Kegel is when the muscles squeeze and lift up towards our head. Research shows the best way to cue somebody to do a Kegel is by saying squeeze like you're trying to hold back gas. So you have to fart, you don't want to. That's what you want to do. You just want to squeeze like you're trying to not hold back gas. What you want to feel is the muscles at your perineum, so here, lift up a little bit. You want to feel things restrict together and then lift upwards. Now, if that doesn't work for you, if you're thinking squeeze like you're holding back gas and nothing's happening, think about squeezing like holding back urine, right? Like you have to pee and you don't want to. Think about lifting a tissue out of a tissue box. And again, do not be frustrated if you can't feel this or if you're not sure you're doing it correctly. Research shows 50% of people do this wrong. 50% of people. So 50% of people do it wrong. That is a pretty good indicator that it's hard to just do a Kegel right off the bat. And again, I spend a lot of time in sessions with people going through different verbal cues, going through different things you can do to feel to make sure you're doing it correctly. But that's how you do a Kegel. The last thing that we're going to do is how do you relax your pelvic floor muscles? And I'm not necessarily going to make you all get into this position because this one's a little bit more physical. So for pelvic floor muscle relaxation, again, our pelvic floor works really closely with our breath. So getting the diaphragmatic breathing part down first, that's step one to learning to relax your pelvic floor. Once you learn how to do that diaphragmatic breath, that big belly breath in any position, laying down, sitting, standing, what you want to do is you want to drop into a child's pose or a happy baby pose and work on that deep breathing. And as you breathe into your belly, as your belly expands, what I want you to do is I want you to imagine a balloon in your belly. As you breathe in and that your belly expands outwards, I want you to think about that balloon also expanding downwards, right? So you breathe in, your belly expands, your pelvic floor drops. There's this piston. You breathe in, everything comes down like a wave, your pelvic floor relaxes. You exhale, everything comes back up and comes to resting. In child's pose, in happy baby, in a deep squat, you can really feel this stretch at the vaginal and anal opening better. Again, please do not be frustrated if that doesn't make sense to you or if you don't feel it. Please sign up for a free 15-minute consult with me and I will talk you through it a little bit more specifically, okay? Let me see, I see that I have a question. It feels harder for me to expand my rib cage and take in a deep breath with diaphragmatic breathing. Can this be because I work at a computer a lot? How can you help with this? So if it feels harder to expand your rib cage when you take a deep breath in with diaphragmatic breathing, it can be for a few reasons. It could be because you haven't practiced it, right? If you haven't practiced it, it's the first time you're doing it, it can be really hard. There are all sorts of techniques that you can do to help you. One question I would have is it harder for your rib cage to expand this way, to expand this way, to expand back, right? Depending on where you feel restricted, there are different exercises that you can do to help improve the mobility of your rib cage. It could be a postural issue. So if you're sitting at a computer all day, every day, and if you're compressing your rib cage, then when you go to breathe, it could be restricted. So we might first want to work on opening up your posture, but that's a good question. Any other questions on those three exercises? Okay, none for now. I'm gonna go back to the PowerPoint. And I know that this is a lot. You guys are doing so well. If you have any questions, please keep asking them. We're gonna have time for a Q&A at the end, but we're getting close. We're getting close. So those are those three exercises. Okay, how do you know an exercise isn't right for you? Right? This is, I think, the most valuable piece of information that I can give people, or one of the most valuable pieces. Like I said earlier, there's no 5 best exercises for this condition. There are also no 5 exercises that are awful for this condition. So if you have pressure, these are the things that you want to look out for while exercising that will indicate to you that the exercise isn't right for you, or that you need to modify the exercise, or that you need a break, right? If you are exercising and you feel pressure, pain, protrusion, or leakage, that is a sign that your body is sending to you to say, hey, hold up, right? Pressure can mean pressure in your belly, pressure down in your pelvic floor, heaviness. Pain can mean pain anywhere. Protrusion can mean if your belly is protruding, so if you're seeing coning in the belly, if your stomach is changing shape while you're exercising, or if you feel any tissue coming down at the vaginal opening, right? So tissue protruding through the belly or through the pelvic floor, or leakage. If you're having urinary incontinence, if you're having fecal incontinence, gas incontinence, those are the 4 signs that the exercise you're doing is not quite right for your body in that moment, right? That doesn't mean that it will never be right for you. It means in that moment, you want to pause. You want to see if you can engage your abdominal muscles and your pelvic floor muscles, and you want to try again. If you do that and it still happens, then you need to modify that exercise to fit you better. It could mean less weight. It could mean less reps. It could mean planking on your knees instead of on the ground, on the wall instead of on the floor. There are a million ways to modify exercises, and I spend so much time with people on this, right? Having prolapse doesn't mean you can't run. Having leakage doesn't mean you can't do CrossFit. It just means that we want to change the way you're doing these exercises, get you stronger so that you can run and do CrossFit for the rest of your life rather than this week alone, right? I think one question. Can you please repeat diaphragmatic breathing? Sure. So for diaphragmatic breathing, that's when you want to put the hands on your belly. You want to inhale slowly while you feel your belly rise. You want to imagine that balloon going not only forward, but also downward, so that you're breathing that air all the way down through the belly into the pelvis, almost imagining your tailbone uncurling as you inhale, and then exhale that air back out. Nice and slow, breathe in for 4 seconds, out for 4 seconds. Okay. I really wanted to talk about this. I'm really excited about this slide because I, for a long time, have gotten the question of, is time enough? And then I saw this study, I think maybe 6 or so months ago, that just did a really good job of explaining why it's not enough, right? Because sometimes things do get better with time. And I tell people that all the time, like maybe time is what you need, right? Time is a very useful resource when it comes to healing. However, time isn't enough postpartum. And if you're waiting for things to get better on their own, you could be waiting forever. So this study, called Urinary Incontinence Persisting After Childbirth, Extent, Delivery History, and Effects in a 12-year longitudinal cohort study. Okay, what that means is they looked at people who leak out to 12 years postpartum, right? They looked at them at 3 months postpartum, 6 years, and then 12 years. And they said, are you leaking? What they found was that for people who were leaking at 3 months postpartum, which I think in this study was roughly 40% of the people that they surveyed, 76% of those people were still leaking at 12 years postpartum. 76. So sure, for 25, 24% of people, time may have been enough. But for 76% of people, it wasn't. 40% of those people who still had leakage at 12 years reported that they use a pad, right? So a pad for leakage. 50% reported that this affects their social life. 25% reported that this affects their work life. And the study said that almost no people reported treatment, right? So time is not necessarily enough. The reason why I take this so seriously is that something like leakage has become kind of a joke in our society, right? I'm going to stop screen share for a moment. Leakage has kind of become a joke in our society, right? It's a meme. People laugh about it. And I get it, because if you don't know what you can do about this, how could you not laugh, right? You either laugh or you cry. But the thing is that this is really treatable, and the effects that leakage have on somebody's life in long term are really significant. It makes people more socially isolated. It reduces people's self-esteem. It makes them less likely to be physically active, which can lead to increased incidence of cardiovascular disease down the road, right? Like, this thing that can seem kind of small in the beginning or kind of like a joke in the beginning can have really long-term damaging effects on our lives. So please, if you are having leakage or pain or any symptoms and you've waited and it hasn't been long enough, know that it's never too late, right? It is not too late for you to get help. The fact that you waited 5 years is not too late to get help. 20 years, it's okay. I've seen people who are 40 years postpartum who still get better. And B, please don't ignore it if it bothers you, right? Because you are not alone. It's extremely common. And there is so much that can be done about this. Okay, let me see. What else did I want to say to you all? We can go back to this PowerPoint one more time now that I'm off of that soapbox, but I see a couple questions. Do you work alongside chiropractors? If so, what differences have you seen in the pelvic floor of women who both get adjusted and work on the pelvic floor muscle contraction / relaxation? So I think this question is really, if I work with a chiropractor and a PT, is there a benefit? I do work alongside with a lot of chiropractors. I work in Austin, Texas, and there are a lot of really, really amazing chiropractors who focus on pregnancy and postpartum recovery, and I absolutely love working with them. What I have seen, I haven't necessarily seen a difference in pelvic floor when it comes to people who work with a chiropractor. The idea with seeing a chiropractor throughout pregnancy is that they can improve your alignment, which can set you up best, right? Improving your alignment allows your muscles to function better. On a person-by-person, day-by-day basis, I haven't seen any people who go, I haven't seen amongst people who go to chiropractors that they're less likely to have pelvic floor muscle tension. I haven't seen that they're more likely to have pelvic floor muscle tension. I think that chiropractors and pelvic floor physical therapists really work on different aspects of birth preparation, and that both can be really, really helpful and really important. But that is a really good question. And I think that another factor is who you feel more comfortable with, right? But they work on different things. And a lot of my patients see both chiropractors and me. I think I have one more question. After a bowel movement, I have been feeling heaviness, but it doesn't last. I'm 10 weeks postpartum. Will working on my pelvic floor help with this? Yes. Yeah. So if you're having heaviness with a bowel movement postpartum, if you're having heaviness of the bowel movement postpartum, that could be because you're bearing down. So I always tell people, don't push and strain to have a bowel movement. Rather, bring your knees up, use a squatty potty or any stool that you can put your feet on. And that can absolutely help reduce the heaviness that you're feeling. It could also be that you have some weakness in the pelvic floor. And so when you have a bowel movement that's irritating, the muscles become more fatigued. So it could be that you need strengthening. It could be that you just need to work on the mechanics. And again, we can talk more in depth about that, but there is definitely a relationship there. Another question, what is your opinion on acupuncture or dry needling? I don't know if you're asking what the difference is between acupuncture and dry needling, because they have two really different functions. I love acupuncture. I don't understand it. I come from a very Western perspective. I have talked to a lot of acupuncturists and asked them to explain to me how it works. I don't get it. It feels like magic. But I do think that it has really, really great impact on people. And so I am all for acupuncture. Dry needling is what physical therapists do, where you can get into the pelvic, into the muscle and release trigger points. So they're different. And then one more question before I give you just my closing up information and we have time for questions at the end. I'm nearly 8 weeks postpartum and still bleeding. Could this be related to my pelvic floor muscles? Or is it more related to my uterus? Bleeding postpartum is not a pelvic floor issue. I would say if you're still bleeding, speak with your OB, speak with your midwife. They might say that as long as it's getting better, that's okay. When I treat people who are bleeding, we always will modify activity. I don't want to do any exercises that increase bleeding, but that's not necessarily due to the pelvic floor. So let's real quickly just go through my last couple slides, and then we'll just open it up entirely to questions. Okay. So this is one thing that I tell people all the time. If you sprain your ankle in a run, you're sent to physical therapy before you're cleared to run again, right? That's normal. Why are we more cautious of an ankle sprain than we are of pregnancy and childbirth? It's comical to compare an ankle sprain to pregnancy and to childbirth, but I do it because for some reason, throughout pregnancy and childbirth, throughout pregnancy, you're going to the doctor all the time, right? You're seeing your midwife, your OB constantly. After you give birth, all of a sudden it's crickets for weeks, until 6 weeks, maybe 3 weeks if you're lucky. But getting this rehabilitative care can be really, really impactful on having a better postpartum recovery. So again, I said this at the beginning, I want today's takeaway to be, if something feels wrong, you do not have to accept this as your new normal. Please remember that. If your provider tells you that this is just part of being postpartum, you deserve another opinion. There are answers to your questions, okay? Please, please believe this. What I am giving everybody who attended this webinar, I'm really excited to offer this to all of you, is a free minute 15 phone consultation, but I'm not going to pretend that that's the gift, because I always offer a free 15-minute phone consultation. If you leave today's webinar with questions, please reach out, schedule a consult with me. You can reach me any of these ways: my website, Instagram, my email, my phone number. You all have a way to contact me because you registered for this webinar. The other thing that I'm offering every single one of you who are listening is 50% off virtual visits for the month of April. So we originally started offering 50% off to healthcare providers affected by COVID-19. As this goes on, there is not a single one of us who has not been affected by COVID-19. There is not a single one of us who isn't under a different type of stress. It is a hard time to be pregnant. It's a hard time to have young babies. It's a hard time to be an adult. And so I really wanted to offer something to you all that could just help to support you through this difficult time, and give you an opportunity to work on these issues that you've been having, if you've been having them for a long time, or get ahead of them, or just manage your concerns with care. I wanted to make the care as accessible as possible. So every single one of you listening today, I'm offering 50% off all virtual visits for the month of April. You can contact me any one of these ways to schedule. And I'm really excited to just be able to reach more people and to help more people through this time, because I know that we're all so stressed right now. So I hope that allows at least some of you to get care who maybe wouldn't have otherwise been able to. Please reach out, ask me about it. I will help schedule you. I'll help answer any questions that you have about PT. But I'm really excited to work with you all and build on this foundational information that I gave you today. So that's really the whole PowerPoint, the whole presentation that I had scheduled. So let's just go to questions now, because I know we're right about an hour, actually, an hour to the dot, because we started at 11:03 and it's 12:03 Central. But let's just answer some questions. When I go to pick up my baby off the floor, I'm in a squat position. I had pubic symphysis pain in pregnancy and still feel pain, although not as bad now postpartum. Pubic symphysis pain during pregnancy and still feel pain, though not as bad postpartum. Tailor sitting also bothers me as it's too much. How can I help my pubic bone, I imagine, come together? I'm not sure what tailor sitting is, but if you're having pubic symphysis pain postpartum, what you want to make sure that you're doing is working on abdominal strengthening, pelvic floor strengthening, glute and hip strengthening. There are a lot of muscles that support the pelvis, right? So this is the pubic symphysis, but there are a lot of muscles that help support the pelvis from all of the angles. Your glutes from the outside, your abdominal muscles from the inside, your pelvic floor from underneath. So you want to make sure you're working on all of these things together. If you're having a lot of pain, you can also use an SI belt, which is an external support belt, to just kind of help keep everything together. But I would say just general strengthening, if you're still having pubic symphysis pain, will be really helpful to you, or figuring out if there is a muscle imbalance, right? If you have weakness in some muscles or tightness in others, how they're interacting to continue and proliferate this pubic symphysis pain that you're feeling. How to sneeze, cough, blowing nose with weak pelvic floor. So there's something called a NAC reflex. The NAC reflex is your body's natural reflexive response to contract your pelvic floor before a cough or a sneeze, or laughing, or anything that increases pressure in the abdomen. After pregnancy, we tend to lose this NAC reflex. So we might not have that automatic response to squeeze our pelvic floor before we cough, before we sneeze. So I would suggest that to you. If you feel like you have weakness in the pelvic floor, if you leak when you cough or sneeze, or feel heaviness, if you feel a cough or a sneeze coming on, do a Kegel, hold it, cough, relax. And then I have one more question. Do you have a specific location where you work from, or other option to travel to people in Austin area? So I have an office in South Austin. Ladybird Physical Therapy typically does in-home, in-office, and virtual visits. With COVID-19 right now, we're only doing virtual visits. We've been doing exclusively virtual visits for the past about 4 weeks at this point. It's been going really well. It's really great. And the feedback that we've gotten from patients is awesome. But we work in South Austin in an office, and then we cover all of Austin with home visits. Let's see if we have any other questions here. Just more about Ladybird PT. So again, this clinic, Ladybird Physical Therapy, my clinic really just focuses on helping people manage pregnancy pain, helping people prepare for birth, and then helping them recover postpartum. I work with a lot of runners, a lot of CrossFitters, and a lot of people who aren't active as well, right? The goal is just to make sure that everybody who is recovering from birth feels supported and knows what they can do to get back to the life they want to be living. That's always my goal, to enable you to live the life that you want to live. So please feel free to reach out and ask any questions that you have. Like I said, I'm offering a free 15-minute phone consultation to everybody. That offer always stands, and 50% off all virtual visits for the entire month of April. So still about 20 days. And if you need to talk about sliding scale, then that's a conversation that we can have as well. Any other questions? I know I've kept you all for about an hour, which is kind of what I planned. But we had lots of questions throughout the way, which was really awesome. And I would be happy to answer any others that we have. See, one just popped up. I have a tilted cervix, and I was told that my baby's head was on the cervix. Could that be part of the reason I could not relax? That's a good question. And I don't want to pretend that I have the answer to that. I think that anything happening in the uterus, in our cervix, depending on the orientation of the organs, can impact the pelvic floor muscles around it. The other thing that could be happening is if there is kind of asymmetry in the cervix, that could cause different muscles to be tight versus weak. So maybe, but I would wonder, chicken or the egg, is that why the muscles can't relax, or what's the relationship there? But that's I don't know. I don't know the research on that. That's a good question though. Can you talk a little about how a virtual consultation will work for a pelvic assessment? Absolutely. So like I said, we've been doing virtual visits for the past month or so, and they've been going really, really well. They've been really awesome. And so when it comes to a pelvic assessment, a lot of what we do, and let's just talk about what a PT visit, what a virtual PT visit looks like in general. So when we start a session, we start with talking, right? I ask you all about your bladder, bowel, sexual history, any history of pain, your pregnancy, your birth history, pelvic health in general, any previous injuries. We spend probably like 30 minutes talking, getting to know each other, where you have a chance to really make sure I understand all of your concerns, everything that you're experiencing, all of your goals, right? What you want to get out of physical therapy. Then that really guides our physical assessment, right? And that's true whether it's in person or whether it's virtual. When it comes to the physical assessment with a virtual visit, when it comes to the pelvic floor assessment, a lot of it comes down to questions, right? What are you feeling? What kind of symptoms do you have? But we also talk through how you can help me by assessing your pelvic floor. So I'll talk people through what they want to palpate. So how to feel, if you touch here, for instance, what do you feel? Is it tender? If you touch here, does it feel sore? Does it feel sharp? How about here? If you stick a finger internally vaginally, what does that feel like? Is it tight? Is it weak? I teach you how to assess your own diastasis. I teach you how to assess your own scar, and I watch you do these things to make sure that you know what you're doing, you feel comfortable with what you're doing. But the physical part of the evaluation really varies from person to person based on what you're comfortable with, and that's true with an in-person exam as well, what you're comfortable with, what you're coming in for. I teach you how to test your glute strength, how to test your leg strength, how to test balance. I watch you do all of these things. And then that gives us really good information to start building a program off of. Now, my hope with my virtual clients is, my virtual patients, is that we can eventually see each other in the clinic, right? I would love to be able to see people in person eventually. Right now, we're just doing our best to respect the restrictions in Austin and do our part to help this all pass as quickly as possible. But the people that I've seen train through virtual visits. Even I had somebody last week who was 6 weeks postpartum. We did her first visit virtually. She was having a lot of leakage prior to that visit, and then she had massive improvement within the first week. So I know that that isn't what we usually expect from a physical therapy visit, but there's a lot of information that we can get virtually. Christy, you're very welcome. Thank you so much for joining. I haven't gotten any other questions, so yeah, you're welcome, Joanna. Thank you all for joining. I really, really enjoyed talking with you all today. Becca, yes, you can find a pelvic floor PT in your area. You can do that by going on the Women's Health American Physical Therapy Association website, or you can message me and I can help you find somebody locally as well. I can send you the links. Feel free to email me at Rebecca@Ladybird PT if you want help finding a PT, if you have any questions about PT. You're really welcome, Carly, Stephanie. Thank you all for joining. I hope you all have a great day, okay?